Ever wondered what a C-section actually feels like? It's one of the most common surgeries in the world, but most people don't really know what to expect. Today, I'm going to walk you through what it feels like to have a C-section, from the spinal placement to the moment your baby is born, in real mom's words, from a nurse's perspective. If you have scheduled a C-section, here's what you can expect. When it's time for surgery, you'll walk into the operating room. It's bright, cold, and a little overwhelming at first. The air feels crisp, and you might notice the hum of machines and the clinking of metal instruments being set up nearby. Your nurse will have you sit up on a narrow operating table to get your spinal, which is like a one-time fast-acting cousin of an epidural. It numbs you from your chest down so you can stay awake and alert and completely safe during the surgery. Board-certified anesthesiologist Dr. Speight explained it beautifully on the Birth Journeys podcast. The spinal works quickly and deeply, allowing the surgery team to start in minutes. You'll still feel pressure and movement, but no sharp pain. The spinal itself feels like a quick pinch, some pressure in your lower back, and then a spreading of warmth and tingling as your legs go numb. Within minutes, your body feels heavy and warm, almost like it's falling asleep. Once your spinal is done, you'll be helped to lay down on the table. Your body may feel oddly weightless below your ribs, like you're there but disconnected from your lower half. You'll be slightly tilted to one side to help with blood flow. Then your nurse will place a monitor on your belly for your baby's heartbeat, then gently insert a Foley catheter to keep your bladder empty. You may feel pressure from touch, but you probably won't feel pain, cold, or wet, which means the anesthesia is beginning to work. After that, your nurse will prep your abdomen with scrub solution. You may feel pressure from touch or tingly as the numbness settles in, but you shouldn't feel cold, wet, or any pain. Then someone will place a sterile drape over your belly, exposing only the surgical site. By then, you may not feel anything at all, or you may feel light tugging as the drape is adjusted and taped into place, but no pain. Once you're prepped, the rest of the OR team comes in. Your surgeon will do a pinch test to make sure you don't feel any pain. They probably won't even tell you that they're doing it because if you don't feel it, it means the anesthesia is working. When everyone is ready, your nurse will lead something called a timeout. It's a safety pause where the entire team confirms your name, the procedure, and any important details about your care. And then the surgery begins. You'll probably hear soft conversation, metal instruments clinking, and rhythmic beeping from the monitors. You may even hear a whirring sound from some of the machines that help remove excess fluid from the surgical site. Your anesthesia provider will stand near your head and talk you through what's happening and make sure you're comfortable and safe during the entire procedure. Once the incision is made, you won't feel pain, but you will feel tugging, pulling, and deep pressure as they move the baby towards the incision in your uterus. Some moms describe it as a feeling like they're doing dishes inside their belly. Not painful, but strange. Others say it feels like their stomach is being pushed, lifted, or moved from the inside. As the doctor reaches your uterus, you might feel your body shift slightly on the table, especially when they apply firm pressure to help deliver your baby. It can feel like someone is pushing down hard just below your ribs or on your chest for a few seconds, because, well, they are. And this is totally normal. That's how your baby is being gently guided out. In total, from incision to delivery, it typically takes about 5 minutes to get the baby out during a scheduled, uncomplicated first-time C-section. If you've had one before, it can take a little longer as the surgeon carefully removes scar tissue and avoids delicate structures like the bladder or bowel. If your baby is stable, the team often waits 45 to 60 seconds before clamping the umbilical cord. In those first seconds, you may hear your baby's first cry even before you see them. Once the cord is cut, your baby will be handed off to the NICU team. They usually quickly show you your baby and then take them to the warmer to be dried and checked by the NICU nurse. Once the baby is deemed stable, either you or your partner will be able to hold them. Some hospitals let you or your partner do skin-to-skin while the surgery continues. While the NICU team examines your baby, the surgeon manually removes the placenta. Most moms describe this as a deep, tugging sensation that's over very quickly. Then comes the longest part of the procedure, sewing you back together. Your surgeon will stitch your uterus, check your bowel, bladder, and the surrounding organs for injury, possibly lift your uterus slightly to inspect the back for bleeding, close the fascia, which is the strong layer over your muscles, and finally close your skin with staples, sutures, or medical glue. You may feel gentle rocking or pressure during this part, but your anesthesia provider will continue monitoring your comfort the entire time. Once your incision is closed, your team will clean your abdomen, ensure your uterus is firm. This part can cause brief, deep pressure, and transfer you into a fresh bed. If you haven't held your baby yet, this is your moment you finally get to. You'll spend about 2 hours in the post-anesthesia recovery unit, called the PACU, with the nurse that is dedicated to you and your baby. During this time, you may feel warm, sleepy, or slightly shaky. As the spinal wears off, tingling and movement slowly return to your legs. Some moms notice shivering or itching as the anesthesia wears off. Both normal and, for the most part, treatable. If you're planning to breastfeed, your nurse will help you do skin-to-skin and assist with your baby's first latch. Every 15 minutes for the first 1 to 2 hours of your recovery, your nurse will gently press on your belly to check your uterus. It can be uncomfortable, but it's brief and important. Your uterus needs to stay firm and contracted in order to close off the vessels that were created to attach to the placenta. Your catheter stays in until you can walk safely to the bathroom, usually within 6 to 8 hours. Once you can tolerate clear liquids, you can slowly start eating again. You'll be offered light, bland foods like crackers, applesauce, and broth. After the PACU, you'll move to a postpartum room. Your nurse will help you dangle your legs at the bedside by 6 hours post-op. Then stand and walk as soon as you can safely do so. Movement helps your body heal, reduces gas pain, and lowers the risk of blood clots. You'll stay in the hospital 2 to 4 days depending on your recovery and your baby's needs. The most common sensations in the first few days are soreness, tightness when you move, occasional burning near the incision, and tenderness with sudden, strong movements like coughing or laughing. Most moms describe it as manageable when you stay on top of your meds. Every C-section feels a little different, but knowing what to expect helps you feel calm, confident, and ready. You're not just having surgery, you're giving birth, and that deserves care, respect, and preparation. If you want to hear Dr. Bella Speight's full explanation of epidurals, spinals, and C-section anesthesia, comment podcast below for the link. It's one of the most valuable episodes for anyone preparing for birth and considering labor anesthesia.